Hello and welcome to How to Fix a Broken Heart. I'm Dr. DeLuca and I'm part of the pharmacy faculty. If you're thinking about how to fix a broken heart, the best way to do it is through prevention. And you might be wondering, well, what's the pharmacist's role in preventing somebody from having heart disease? There's several roles that pharmacists have, and the first is to counsel patients about how to reduce their risks. There's lots of risks that we can modify. These are things like changing our diet, achieving an optimal weight, getting enough exercise and the right kinds of exercise, as well as quitting smoking. Pharmacists can counsel patients about all these things. And with quitting smoking, there's a lot of different strategies to help patients quit smoking. Some of them include medications, some of them don't include medications, and we can help patients to find the right strategy that fits their lifestyle and will help them to quit smoking. So another way is to counsel patients about how to improve their underlying problems. A lot of people don't understand that having high blood pressure can actually increase your risk of having heart disease. And so pharmacists can counsel patients about what is their goal blood pressure, how can they achieve that, what are their medications for, and what other things besides medications can patients do to lower their blood pressure. There's a lot of things like decreasing the salt in their diet and getting more exercise and losing weight. And all of these things have been shown to reduce blood pressure. And if you reduce blood pressure, you can decrease your risk. Another example of a disease state is diabetes. Diabetes is associated with an increased risk of having heart disease, but we can manage it. We can do things with our medications, adjusting them to get optimal blood sugar levels, and patients can also do other things that don't involve their medications to help them to get better control of their diabetes. And all of these things can decrease their risk of heart disease. Pharmacists also work with physicians and nurses to make sure that the medications that the patients are taking are right for them, that they can improve their outcomes. What kind of outcomes? Like decreasing the risk of a heart attack or a stroke, or maybe increasing the chance that they survive longer. Pharmacists can also recommend medications that can increase the risk. They can recommend medications to avoid increasing risk, or medications that could cause side effects that make patients not want to take them. So pharmacy students, they learn how to counsel patients. They develop skills to find relevant evidence, how to interpret it, how to read clinical trials, and most importantly, how to apply it to individual patient care. They also learn how to manage disease states such as high blood pressure and diabetes so that we can improve patient outcomes. We can keep them living healthier and longer lives. They develop skills to be an active member of the healthcare team. What's that mean? It means working with doctors and nurses and dietitians, nurse practitioners, all kinds of health professionals working together to do what's best for the patient to improve their health. We also have students work with faculty members on research that can demonstrate the value of pharmacists in improving the quality of care provided. Our pharmacy students present their research at national conferences, and many of them have also co-authored papers with faculty on these topics. So that's a really short introduction into what pharmacists can do and what pharmacy students learn about how to prevent heart disease. I thank you for watching it and thank you for your interest in pharmacy, and we'd love to talk to you more about it. Bye-bye.